And I'm delighted to have Ciara Mahon kicking that off. So Ciara is an IRC Enterprise postdoctoral researcher within the school. She's working with Amanda, who will also be presenting in this session, and with Jigsaw, which is Ireland's National Centre for Youth Mental Health. So her research, which she's going to talk about now, is focused on studying body image interventions for young people in order to identify and understand ways to improve body image. And prior to that, she worked on the My World survey. So thank you very much, Ciara. Looking forward to hearing what you have to say.
So thank you so much for that lovely introduction, and it's lovely to be here, and I'm delighted to be presenting on the current research project that I'm involved with. This is a collaboration between Jigsaw, ECD, it's funded by the Irish Research Council, and I'm working with Amanda Fitzgerald on this. So I suppose to start off, what's the background or context for this issue? And body image is an issue that is of key concern for young people, particularly teenagers in Ireland. Recently there was a survey that assessed, I suppose, factors that impacted psychological well-being in young people, and body image was the second key concern for young people, second only to exam stress and worry. So it's very much at the forefront of an issue affecting young people. Our latest global report of statistics on this kind of topic found that about 77% of adolescents worldwide report body image distress. The My World survey, which is the National Survey of Youth Mental Health in Ireland, found that less than half of adolescents in Ireland are satisfied with their bodies. And more recently, particularly in the last decade, we've seen increases in body image concerns and eating disorders, particularly among adolescents. And also, particularly in the wake of the COVID-19 pandemic, we've also seen a spike in body image concerns. And this is kind of illustrated by the statistic that was in Ireland. We saw a 66% increase in acute hospitalisation admissions for eating disorders among adolescent girls between 2019 and 2020. So just again, highlighting how much of an issue this is. When we think about body image, it's not something that's very superficial. It has a range of impacts for psychological, physical, social well-being. We know that body dissatisfaction is one of the key risk factors for eating disorders, but also having poor body image is linked to reductions in engagement in health behaviours associated with disordered eating and exercise, and it has more wide-ranging effects, so it can impact affect and self-esteem, in addition to even impacting academic performance. So again, there are kind of no benefits to these experiences of body dissatisfaction. And a lot of the research in this space has tried to identify ways to reduce body dissatisfaction among young people. But increasingly so, we've become more aware of another construct in this space called positive body image. So positive body image is your capacity to appreciate your body, what it does for you, accept your body despite it not maybe matching societal ideas of ideal bodies. It's associated with kind of a capacity to care for and nurture for your body, and it's a unique construct that is quite distinct from the affective experience of dissatisfaction or satisfaction. And we know that positive body image is uniquely predictive of a range of positive outcomes for well-being. It's associated with increased likelihood of healthy eating, exercise enjoyment, reduced eating disorder risk, and improved life satisfaction and well-being. We see that even young people who have more positive body image tend to be less negatively impacted by appearance content on social media. So again, there's great kind of, I suppose, interest in trying to promote this as a construct among young people. So within the research, there's been a lot of work in this area and a lot of progress made in terms of how do we kind of support body image among young people. But there are many key gaps that remain to be addressed. And one of those is that there's a lack of evidence-based body image programs, particularly for middle to older adolescents. So most of the research that exists has focused on those in the early adolescence, so first or second year of secondary school. But we know that body image actually affects adolescents across the adolescent period, and we see that actually 16 to 20 is the peak time for body image concerns and eating disorder onset. So there's a really pressing need to be able to support adolescent body image development across adolescence. We also see that many of the existing programs that were developed are now outdated, so they kind of maybe have focused on traditional media and not adapted to the current social media context. Or they've traditionally focused on women and females only, but we know that body image increasingly is an issue for boys and people across the gender spectrum. So again, we need to have programs that can address the needs and address contemporary issues for adolescents. And again, many of the existing programs have focused on reducing body dissatisfaction, but don't have this strengths focus, i.e. to try and build the positive body image element. So in essence, what we do need is a mixed gender, universal body image intervention that's acceptable, effective and scalable. And so this has brought me to the current program that I'm evaluating. So BodyKind is a 4-session, teacher-led, school-based program for adolescents aged 14 to 17 years. And this program, I've worked with these colleagues, international colleagues, to develop this program over the last 2 years. So actually Dr. Sally Yeager, who visited the school last year, was my thesis examiner, and she liked the work that I did. My research for my PhD focused on self-compassion as an approach to support positive body image among adolescents. And so this was kind of a novel approach in that population. So she drew me in on this international project with Dr. Jennifer Webb, so she's from UNC Charlotte in the US, and Denise Hamburger, she is the executive director of the Be Real Foundation. And Be Real Foundation, their kind of mission is to create educational resources to support body image in schools across the US. So I was drawn into this project with the team to develop a new body image program that would specifically target older adolescents in the US context. And so we have developed this program, which is unique in several ways. So this program is one of the first programs to approach body image from a multi-pronged perspective. So we've found in the literature that there are many effective approaches for supporting body image, but this is one of the first to draw them together and to target multiple different ways into experiences of body dissatisfaction and positive body image. So one of the approaches we draw on is cognitive dissonance. This has the most evidence base behind it, and this is the idea that if you kind of publicly critique body ideals, you'd be less likely to pursue these ideals because it creates a dissonance. Self-compassion, and this is my research area, self-compassion is considered an emotional regulation strategy that helps self-soothe in times of difficulty and distress. And critically, self-compassion helps target self-criticism and shame, which are at the root of body dissatisfaction. It also incorporates some newer elements of the body image space. So one of these being compassion for others. So it's really interesting hearing the talk earlier about this kind of area of pro-social behaviour, because this is a new focus in the body image space that maybe we can promote body image in a personal sense through creating environments that are more acceptive and supportive of body image in others. And then the social justice perspective. So again, recognising that there are kind of structural features in our society that can lead to concerns, and maybe advocacy and social justice is an approach that we can adopt to promote positive body image. And there's research to kind of support all of these approaches. So a quick overview of the 4-lesson program is that we have the first lesson is looking at challenging these biases that exist based on appearance. And the focus of this lesson is trying to encourage people to accept natural diversity. So within this, we have kind of a lot of storytelling techniques where students are exposed to 26 different body stories of people of different gender identities, ethnicities, sexual orientations, abilities, and seeing people, these kind of lived experiences from other people's perspectives to firstly empathize with other people's experience, but also be able to relate to their own personal concerns. We also have self-compassion and looking at how to reframe self-critical thoughts that might arise when we engage in comparison on things like social media. Then we have the compassion for others and learning how to become agents of change. So how to maybe advocate for kind of equality in this space. And these are kind of some of the lessons that we use. Again, very interactive program, a lot of activities involved, and this is kind of just a quick outline of it. And we've piloted it in the US. We've actually conducted 2 trials, but again, we've seen really positive feasibility and acceptability data, which is really encouraging. This is the most positive code you could ever hope for from a trial. And so, and again, this was in a disadvantaged neighbourhood with over 95% racial ethnic minorities. So again, a new population to explore, and we've kind of, again, very heartened by the feedback that we received on that. So this brings me to the current project that I'm involved in. Being involved with this and trialling it in the US, I was really excited to bring it to the Irish context. Again, I've kind of, and so to do this, my kind of research takes 2 kind of perspectives. So the first study was a co-designed cultural adaptation of BodyKind to try and make sure that the content is applicable to the Irish context, and then evaluating this program in an effectiveness trial using RCT design. So I'm briefly going to touch on the co-design piece, but my focus is on the RCT for today. So again, this programme was developed in the US context, but Ireland has its own unique cultural context with its own unique appearance stereotypes, language, and again, we wanted to make sure that BodyKind was deliverable in Irish classrooms and given the time scales as well. So to design our culturally adapted programme, we conducted some kind of workshop, we conducted a co-design workshops with students. So I delivered the programme to them, and then we conducted 2 workshops where students co-designed content to make sure that it was applicable to the Irish context. We also interviewed teachers and clinicians who gave feedback on the programme, and we've incorporated all of this kind of feedback into a new adapted version for the Irish context. And again, we saw very positive acceptability findings from the students and teachers who took part in the co-design workshops. Again, finding it like a enjoyable and an important topic. And again, something that is really relevant, and also for teachers, a resource that was needed because it's coming up in the classroom and they feel that they want resources to be able to support students, and that this was something that was valuable to have to hand. And again, we did make, these is just an example of some of the co-design workshops. So for example, we asked students to create body stories that would reflect the appearance concerns of Irish students in the Irish context. But we did other kind of design thinking ideas to modify the programme. And again, based on this, we've developed some Irish body stories that capture some of the unique appearance stereotypes, for example, red hair or appearance pressures associated with GAA. We've kind of adjusted the timetabling to suit 14, 60-minute schedules, etc., and ensure the language is culturally appropriate. This brings us on to the cluster randomised trial, which is currently ongoing. It's a parallel to arm cluster design. We have our aim was to recruit 600 students and have half and half in the intervention and control group, and then conduct some very fancy analysis to figure out whether this programme is effective. Our primary outcomes of interest are positive body image, body dissatisfaction, and psychological well-being. We also have several secondary outcomes which are linked to the intervention components, and we want to see if these mediate the kind of the change that we expect to see. We're also interested in moderators like gender, baseline scores, because this is a universal intervention, so people may have varied levels of body dissatisfaction going in. And we also are conducting a process evaluation, and we're kind of using that to test whether implementation quality across schools impacts the scores that we see, because again, this is teacher-led, it's in a pragmatic setting, so again, this is really important to account for in terms of seeing effects. So I suppose we've had, the progress to date is that, so I'm just trying to see if the video link works. Yeah, okay. So yeah, there's been many milestones along the way. So I've conducted, or I was invited, well, I won a grant to the US to the Charlemont Research Grant to visit my colleagues in Harvard and UNC Charlotte, and also in the Be Real Foundation, and we culturally adapted the content or based on the Irish co-design trials when I was on this visit. And also then we hosted a webinar with ESCI, so the Educator Schools Network. They host CPD, or continuous professional development for secondary school teachers across Ireland, and also Jigsaw. So we collaborated together to host a webinar which was attended by over 300 principals and teachers across Ireland. And again, that helped in terms of our recruitment. And also the project received a lot of media attention. So we featured in the Irish Times, there's a feature article by me, Jimenez, and this is me on the Pat Kenny show on my holidays in a camper van in the Dolomites. So that was quite the experience. But again, this helped us recruit 23 different schools across Ireland. And then of course presenting the co-design findings at the ISPA conference, School Psychology Conference. We then hosted BodyKind teacher training in August this year. So Denise Hamburger, CEO of the Be Real Foundation, actually travelled to Ireland to co-host the training, and we trained 35 teachers in total. And also we collaborated with ESCI to host these training events across Ireland, because again, we have numerous schools across Ireland involved in the trial. So this is just an outline of what the programme looks like itself, and the toolkits that teachers receive when they sign up to the 2.5-hour training. So in terms of the RCT trial, we have pre-registered the trial on and published the protocol on the BMC Public Health. And also, this is just an example of the surveys that we're using, and we have piloted these surveys with student members of the Irish Secondary Schools Students' Union to ensure that they're easy to understand for students in TY. And so currently we are involved in the data collection piece. So at pre-intervention, we have gained, we have about 1,200 students involved in the program, and the teachers have now started, or are in the process of delivering BodyKind to students across Ireland. And I have clocked up quite a number of miles on the clock trying to go out to all the schools and visit them. We have schools in Donegal, Cork, Kerry, Dublin. So it's really exciting to see this kind of natural, or kind of a nationwide spread of the programme. And yeah, so we're currently conducting round 2, the post-intervention, as we speak this week. So what we hope is that this research will contribute to the evidence base on body image interventions for 15 to 17-year-olds, that it will extend our knowledge on mechanisms of change, particularly looking at self-compassion and social activism, which are relatively novel concepts, particularly in the adolescent space. And what we hope that, if this is effective, this programme will be part of the services that Jigsaw provide, or universal supports that Jigsaw provides to schools, and that this research will actually translate into practice and be self-sustaining. So I'd just like to acknowledge all of the team that are involved in this, particularly Amanda Fitzgerald, also our 2 students, Georgia Brown and Katie Morrow, who are currently collecting data today, and also the extended team in the US who've been instrumental, and all the partners and collaborators on this project. And thank you all for your time and attention this evening.